Um, Great. So we'll kick off, and I'll first start by introducing myself. My name is Arjun. I work here at Napier's. I'm currently at the Bristow Place store. It's our original store from 1860. We are a 165-year-old herbalist and have been practicing since that date, pretty much exclusively from this location. I'm stood in the shop. You can see some of our lovely products. We do herbal remedies is obviously our core, but we also do skincare, teas, tinctures, a whole host of different products, but all rooted in herbal medicine. We do have a clinic next door where we see hundreds of patients every year with all sorts of health conditions and issues, from skin problems all the way through to menopause, hormonal issues, as well as things like stress and sleep. So we see all types of problems, and we come up with personalized herbal remedies for people, and I'm involved in the kind of processes around that. Today, I'm very excited to welcome Claire, who is one of our more recent herbalists in terms of joining Napier's, but she's been practicing for quite a few years now. I'll leave her to introduce herself, but I think she is one of the best placed people in the herbal world to talk about endometriosis in detail because of her kind of own experiences with endometriosis. But yeah, really this webinar is going to be as informative as we can be for an audience without getting too in-depth into specifics. We'll talk about what endometriosis is. Of course, it is something that affects millions of women globally, but really there just isn't the information, the awareness, or the sort of accessible treatment that we would like to have and to see. Often they're quite invasive procedures or treatments, and so herbal medicine is definitely a route to helping with that. And so I will hand over to Claire just to sort of introduce herself. As I say, hold your questions or pop them into the chat. We'll collate them and we will answer them at the end. So yeah, over to you, Claire, if you'd just like to introduce yourself and give us a bit of background about yourself. And yeah.
Hey, hello everybody. Thank you so much for joining. And thank you to you, Arjun, Napier's. So I'm one of the clinician herbalists. I retrained as a medical herbalist about 4 or 5 years ago. So this is as Arjun said, this is a bit of a whistle-stop introductory presentation. So I'm going to go through some of these slides, and I'll tell you a bit more about me as the slides pop up. And we're going to have lots of time for Q&A, as we said at the end. So it is Endometriosis Awareness Month, so just to highlight that and celebrate that, we're still in the month of March. So do check out Endometriosis UK for the work that they do. They do a lot of advocacy and research, and they're an amazing charity. I did a talk with Endometriosis UK Wales last month in February around chronic pain. So that will be coming out live, that talk soon. I'm going to flick this way. So the takeaways of this session, hopefully I'm going to be able to give you a few practical herbal solutions. So we're dealing with a dispensary of over 400 herbs that we can work with. But I'm going to hone in on just a few, just so it's hopefully bite-sized information. We're going to talk a little bit about the immune system and how that interplays with this condition called endometriosis. We're going to talk a bit about what that is, the nitty-gritties in a moment. I'm going to give a brief introduction to menstrual cycle awareness and how that's helped myself, and how that I work with my patients using this practice. But yeah, just to say, endometriosis, or endo, I'm going to probably refer to it as a lot throughout the presentation. It is as an individual as you. It is a very complex and very, it's a hard condition to fully treat. There is no cure, and there's a myriad of different approaches. Everyone will present will come with their own symptoms, their own sort of issues. So it really is as individual as you, and the treatment plan and the herbs and the approaches that I would use or my team around me would use would differ depending on the person. So there really, really is a huge value of speaking with one of us one-to-one, and we all do free 15-minute calls. So do check that out at the end if you've got more questions. So just a little backstory. Here's me back 5 years ago over in India, and that's when I decided I'm going to retrain and be a medical herbalist. My periods started getting pretty debilitating and more problematic in my late 20s. I used to pass out, throw up occasionally, and all of the pain that comes with the cycle I experienced. And pain is very subjective. Pain is very different depending on person to person. It's a tricky one to you can't take away someone's pain. Everyone experiences it differently. But yeah, I can say I've had my fair share, and that's not a sympathy vote. It's just how it is. That is one of the key things that comes with this condition. So I was diagnosed with the only gold standard medical diagnosis tool, which is the laparoscopy. That was back in 2021. And by that point, I was a year into the BSc in clinical herbalism degree. So there's only one BSc that you can study at the moment in the UK, and that's up in Lincoln. So I did that degree, and I specialised in hormonal health, and I researched endometriosis in my research undergrad thesis. I'm going to level with you. I do still get symptoms. Herbs haven't completely eradicated my endometriosis journey. I still suffer with pain. I still get PMS and fatigue. However, if I look back to how it was about 10 years ago, even 5 years ago, to how it is now, things are hugely different. I've minimized things greatly. And this is through combination of the right herbs, diet, menstrual cycle awareness, which I'll go into, and with that, rest and resting around the cycle and allowing your body to settle. So I've got a bit of a toolkit of resources, and I apply these into my practice. So right now, I'm working full-time as a herbalist. I work a lot with online with Napier's. Very grateful for that. I'm a member of the National Institute of Medical Herbalists, which is the awarding body, membership body in the UK. But they support herbalists from around the world. And this is why I do what I do. I'm a specialist in this field because I navigate this condition, and I'm passionate about supporting others. As I say, I work in person down here in Bristol where I'm based, but I work a lot online. I run workshops, retreats, and training programs. Last year, I was really honoured to stand in front of a team of consultants and gynecologists at Newport Hospital in Wales, and that was a training seminar to do with chronic pain, specifically around endometriosis. And it was a whole multidisciplinary team coming together, and they invited me along to talk about herbs and how that could be incorporated into a treatment plan, which was very humbling because it was really nice to see a bunch of very top consultants go, we need help. We've got wait lists as long as our arm, etc. And we are open to new approaches. So it was a very progressive day, and it gave me a lot of inspiration and hope.
Claire, I just wanted to just touch on that point. So that sounds extremely positive in terms of working with, I guess you could call it allopathic medicine. Do you find that things are starting to shift in that world where endometriosis is being highlighted a bit more? Because from the research that I've done more recently on it, is a lot of women don't get the sort of diagnosis, or they're never really given that the acknowledgement that they have got endometriosis, or that there is an underlying issue beyond just their maybe just seen as heavy periods or whatever it might be, sort of almost dismissed. Do you think that's sort of changing a little bit more now?
I think I was very honoured to be in front of a very progressive team that have a specific pelvic pain physio department within the gynae unit at this hospital, which is quite unusual, I'm going to be honest. I think there are pockets and there are GPs and there are certain research. There's data out there and the mind shift is slowly changing, but we've got a long, long way to go. There's still a lot of medical gaslighting, there's still a lot of dismissive behavior. It's a complex disorder, so a lot of things are missed because, as we'll go on, just a lot of people will go to a doctor and talk about painful periods, but that could be dismissed into the checks aren't being followed up. However, I would like to say yes. I think it's a lot about self-advocacy and really trying to really push for the referrals and really push for the gynae referral. And I'm very, very passionate about that when I work with my patients. Like, go back to the doctor and ask them, I'm being debilitated by this pain. This is really affecting my daily life. And I think it unfortunately is a bit of a two-way of advocating your needs. I think there is a slow shift. I think it depends on the NHS department and where you are, and everyone will have a different opinion and a different experience of that. Yeah.
No, that does answer that very well. I think it's sort of highlights where we are with women's health and hormonal health in general. I know it's a similar story with menopause, although menopause at the moment is having a bit of I guess a bit more of a spotlight shone on it in the media. So it would be great if that can slowly kind of transition and happen with endometriosis as well. I know it's a bit of momentum sort of building, but really it's all about, I guess at the current stage, it's just about women advocating for themselves. Because as we'll go on to talk about and discuss, it does sound like it's extremely debilitating in more than just a regular chronic disease might be. So yeah, absolutely.
I mean, there's a whole amazing discussion there around like a very culturally ingrained taboo around talking about menstrual cycles, talking about periods. It's still an area that some people don't feel culturally, religious reasons, a whole host of reasons. A lot of people are going to struggle to advocate for themselves, and that's systemically ingrained. So it's a complex thing, but more education, more empowerment, more autonomy. So they're my three pillars. So let's talk a little bit about what it is. You've, I'm sure, all read like all the stats. 1 in 10 women or female identifying will have endometriosis in their lives. It can take up to I think 9 years to be diagnosed, right? So all the stats are really there at your fingertips, but let's try and like pinpoint a little bit of what it is, what it isn't. Endo is defined as any endometrial cell growth found outside the lining of the uterus. The uterus is the womb. That's the anatomical term. That picture there is a picture of the uterus. So it is commonly described as an estrogen dominant condition, which is therefore categorized as an endocrine or hormone condition. Now, this is true. It is a hormone endocrine condition. It's not the full story. It's not just a hormone condition. It is affected by estrogen, but it's not caused by estrogen. So estrogen levels and estrogen dominance are affected by this condition, but it's not to say it's caused by. Okay. And if I can flick to, so it's endometriosis. The cell growth can be anywhere else. So outside of the lining, it can be most common areas that it's found in the other areas of the reproductive systems, so commonly in the fallopian tube or the ovaries, other areas, Couch Douglas, other areas that can be anywhere in the reproductive organs. It can also present in the bowel, in the spleen, in the liver, in the brain. It can be anywhere in the body, and that's probably less commonly known. There are certain areas that it like presents more commonly, but essentially it's like abnormal cell growth that can be found in anywhere else outside of the uterus lining. And just a quick note, adenomyosis is very similar in terms of its presentation. So the way it like symptoms that can present. But that is, it's like its sister. Adenomyosis is a sister to endometriosis. And it's when the lining is in the myometrium. So there's abnormal cell growth in the myometrium. So it's slightly different. It's not the same, but they have very similar characteristics. Let's have a look. So just to sort of bring this into the conversation, I'm going to really talk about this in summary because we haven't got a huge amount of time. But the take home is endo is a whole body inflammatory and immune dysfunction or disease. It causes complex alterations in immune function. Okay, it causes signals in the body to misfire and produce inflammatory chemicals. And this inflammatory is what it's all about with endometriosis. This is what's going on in the body, and this is what we're trying to minimize. This conversation around it being linked as an immune dysfunction isn't always in textbooks or on literature. It's more of a new research that's being publicized. So I'd recommend checking out Lara Bryden's research. She's one of the leading kind of literature publishers on this area. And she's got her own website and podcast, etc. So I would check that out. But like we've talked about at the beginning, Arjun's mentioned, it is still quite doctors will sit there and go, we don't really know, because it's an area that they still don't really understand how it manifests and the real sort of known cause. And that's what we really like in biomedical modern practice, modern medicine. We want to know exactly why, but there's still a lot of question marks in lots of areas of medicine, and this is one of the big question marks that affects thousands of women. So more research, more funding, more papers.
Yeah, I think that's a massively important point you've raised there, Claire, because currently we just don't have the evidence or the research to really back it up, and maybe that's why it's kind of taken a bit of it's a bit of an afterthought for a lot of GPs who kind of obviously whenever they're looking up new research and stuff, there just isn't that sort of volume of research compared to other sort of more common hormonal diseases and issues. And so I think you classifying it, and obviously the wider community classifying it as an immune issue rather than just a hormonal problem will be really key in moving the whole space forward, and hopefully that will change the sort of language around it and the attitude around it, because absolutely there is a misconception that it is just linked to hormones, which I think you've touched on a really good point that it affects the whole body in such a inflammatory way that it is much more akin to immune disease than immune dysfunction.
Yeah. And the jury's out whether it's an autoimmune disorder, but there's a conversation going on as well. Like, is it autoimmune? Is it not? So it's still there's still lots of schools of thought and research going
Claire,
on.
Just on that point, what's the kind of distinction there between autoimmune and then just a general immune dysfunction?
Autoimmune is like when your immune system is essentially starting to like attack itself and misfire, and an immune dysfunction is like certain mast cell activation, which I'll talk about in a minute, is like the increase of inflammatory markers. So there is a distinction there. I hope, yeah.
Brilliant.
So I hope that's like not caused too much confusion, but it's just to enter that in as a conversation that it's more than just your hormones. these are a list. I'm not going to read them out. You can read them. So these are like, if you look at common symptoms, this is what you're usually seeing. And these are the key things that I would see in my practice. Painful periods being at the top, because that's one of the key things that is seems universal. However, just to say, someone with endometriosis can be asymptomatic, which means they may not experience any symptoms for a number of years. So there's that going on as well. And then there may be something that changes in their life, or a transition, they tip into more perimenopause, and then they may start experiencing more hormonal influxes and start experiencing stuff. But generally speaking, these are the main symptoms that a lot of women will experience. So key things to think about here is our female cycle is cyclical. So there's certain hormones that are released at the beginning of the cycle, and day one in your menstruation, there'll be an increase of estrogen that will peak around ovulation, and then will start decreasing. And this happens again with progesterone, which is like our love, one of our love kind of comforting hormones that the body produces. And one of the key things in endometriosis is the progesterone really like severely drops off, and this happens usually around, well, commonly it's the luteal phase, so it's after ovulation into that third stage of the cycle. And that's usually when a lot of these symptoms such as PMS, PMDD, fatigue, insomnia, pelvic pain, these are some of the key things, or gut issues. This is where mostly people will experience their endometriosis symptoms more in this second part of the cycle, when there's more of an influx of hormone shifts.
Okay. And so Claire, just on that, and so with the symptoms, do they tend to track more with uterus owning people's cycles, or is it just, it can vary really much down to the individual of when symptoms might be at their worst, or do some women just suffer throughout a whole month and there's not really linked to the cycles? How does that kind of play out on a wider audience, or is it very much down to the individual and how the symptoms present themselves?
I mean, I think if we ask that question to everyone here, they'll have a slightly different opinion. Mm-hmm. But generally speaking, the symptoms are going to usually ramp up around certain times of the cycle, certain phases of the cycle. They may also, and that was also be because of where the endometrial cell growth is. So say someone's experienced really chronic gut dysbiosis, lots of leaky gut, IBS symptoms, fluctuating between constipation and diarrhea and other gut issues. There may be small intestinal bacterial overgrowth and other gut dysbiosis. This may be that the endometrial cells are in that area, and they are causing more inflammatory markers and causing the gut to have these symptoms. Some people do experience, and I've worked with, that have chronic pain throughout their whole cycle. There's no let up, and that's horrendously debilitating for them. But most people will have like grace periods, and they'll have like times of the cycle that they're asymptomatic, they're not having any symptoms, and then they'll rev up around usually the luteal or the menstruation when they're actually bleeding. Does that answer that?
Yeah, that does, absolutely. And I guess one of the challenges then, therefore, is if you are going to your GP when you're perhaps not suffering as badly, then they might diagnose the issue as something else. Like a lot of what you're saying, the symptoms could be a number of different things, whereas actually pinning that down to a certain specific thing would be very difficult for a GP. They're not looking at the whole person throughout a whole month, for example. They tend to go by just how you're feeling on the day when you're having an appointment, which I guess as a herbalist is something that you is a point of differentiation, isn't it? You would ask someone, you know, more broadly how they're feeling rather than just at that specific moment during the consultation.
Yeah, absolutely. I mean, I would want to track someone's cycle for at least 3 to 6 months, ideally, to be able to really get a really in-depth case history of what their symptoms are like throughout the month, and get them to take a really detailed note and record. And then if you're taking that to the doctor, like, I know on week 1 I feel this, I know on week 3 I feel this, and you can give them that information, which sometimes a herbalist can really help advocate for. Then they come in with a lot more, as you say, a lot more information for the doctor to work with as well. So yeah, I think it's that two-way thing. More awareness of what's going on can really massively help.
Fantastic. So that's a good advice point for anyone who's watching, is maybe start to keep a bit of a symptom tracker, a daily diary of how you're feeling over a given period of time. The more information you can build up, and as Claire is saying, you present a bit of a stronger case to your GP or health provider to then say to them, look, you know, the symptoms aren't X, Y, and Z just during this period. It's kind of much more longer term, and then hopefully that's kind of the kind of push that they would need to escalate it and maybe give you that diagnosis that you need and will have to have in order to progress treatment potentially through that route.
Yeah. Okay, so let's talk about herbs, because that's what we're here for, right? Mm-hmm. So in a nutshell, as medical herbalists, clinical herbalism, it's a bit of a marriage. It integrates an ancient practice with modern medicine. And the main difference, say, if you're looking at, say, homeopathy or other modems, the herbal medicine uses whole plant extracts. So instead of 1 or 2 compounds that have been extracted, we use the whole plant. So we use the whole bark, the whole root, the whole leaves, the whole leaf, a flower, etc. And there it's extracted in different ways, like alcohol tincture or non-alcohol glycerin, or dried herb that's then you can use as a tea blend. So I'm going to talk through a couple of herbs in a moment. But yeah, that's essentially, it's the whole plant. It's the original medicine, and that's something that we forget. This is the original medicine that doctors would go to people's houses with their box of or their bag or their suitcase of herbs, and that was how they would treat their patients. And it wasn't really that long ago that we were just purely working with the herbs. So there's been a huge advances in modern medicine. I'm fully behind modern medicine, not against it. I work with it, and as a herbalist in my practice, we work extensively with herb-drug interaction to making sure that the herbs that you're on are safe with any medication, heart medication, antidepressants, beta blockers, etc. So the herbs sometimes do have safety, and we need to observe that and make sure it's safe. That's another really key reason to be able to consult someone like a herbalist or a naturopath, or because there's a lot of misinformation out there. The internet is an incredible thing, but it can be also misleading. And it's good to speak to someone that has done their research and that has the right databases to know things are safe.
Yeah, that's a really apt point for me, at least, or relevant to me. Just to give you guys a bit of background, I studied medicinal chemistry, so I do get asked a lot. People come in and they're unsure about the efficacy of herbal medicine. I would just like to assure you and reiterate what Claire is saying is it is all the original form of chemistry is all plant-based, and what you find in pharmaceuticals is they may find the one active molecule that works really well to help or treat, for example, inflammation or pain. Aspirin, for example, is isolated from the willow plant. So yeah, it is important to note that it can be used in conjunction with modern medicine, and with the help of a herbalist, you can make sure that you're not having any interactions with any medication if you are on medication. So there are avenues and ways that we can, or a herbalist can work with you if you have got other treatments and protocols as well.
is actually herbs, generally speaking, have a lot less side effects than mainstream medication anyway. The body can recognize the herbs and is bioavailable, and it absorbs and it excretes what it doesn't need. So it's generally a safer way of administering medicine. So I'm going to talk about a few specific herbs, right? So from a herbal perspective, and we're looking at treating endometriosis, key thing, as I've mentioned before, is reducing inflammation. So this, from a more scientific perspective, is reducing the mast cell activation. And when we're talking about mast cell activation, we're thinking histamine response, prostaglandins, and cytokines. So these are all very intrinsically linked to immune function or immune dysfunction. So if we're looking at inflammation, we're looking at supporting and modulating the immune system. Another key perspective from a herbal point of view is supporting the liver. I'll talk a bit more about the liver in a moment and all the herbs that, and why we support the liver. But essentially, we want to try and metabolize and help the liver to do its job, and eliminate and metabolize and get rid of excess hormones. We want to help balance the hormones, so modulate or support the hormone makeup to regulate a bit more. So some herbs that I'm going to talk about in a moment can be really good at helping that hormonal balance. Key thing is toning the organs and toning the tissue. We want to improve the circulation. So the herbs are very good at helping to move the blood and move blood circulation, and to then decrease stagnation. So from a herbal perspective, endometriosis presents in a very a lot of pelvic stagnation. So we want to move things around, get things moving, get things eliminated. So adding heat and warming herbs can be really helpful for that. And yeah, just generally help tone the tissue with astringent herbs. So a bit of terminology you might not be familiar with, but I'm talking more from a herbal perspective. We can answer more questions if you have them. And another key area, and there's many others, but is supporting gut health. As I mentioned before, addressing dysfunctions like SIBO, small intestinal bacteria overgrowth. One thing I haven't put down on this slide, which I really want to highlight, is from a herbal perspective, it's all about regulating the nervous system. So stress, pain, inflammation is all going to increase agitation, and the herbs are very, very good at helping to bring down that excess symptomatic state. So that adrenaline, that cortisol that we need, but we have too much running around our bodies from day to day, and the herbs can be very, very good at settling on a very deep level, which can then allow the body to do its thing. It heals itself then through the nervous system response, the parasympathetic nervous system. If do you want to ask any questions? Should I chat on with some of these herbs?
Sorry, what was that? I didn't quite catch that.
I'll just keep going. Yeah.
It sounds good. I think the main takeaway that I got from that, and maybe the listeners would have got from that as well, is that because it is related to the immune system and immune dysfunction, it will affect so many different body systems, and so tackling those, individually is a good way to do it. But you can look at it more holistically as well, and maybe cut down the amount of supplements and the amount of herbs that you might be taking, because there are probably a few that you might be able to take that cover quite a few bases, I think. And yeah, unfortunately, I think it sounds like there's quite a lot of stuff that you would possibly need to do in order to get a grip of some of the symptoms that you might be facing.
Yeah, and everyone's different. Everyone responds differently to the herbs, but I guess I just wanted to highlight that there's some very key things that we look at as herbalists, and these are some of the kind of key areas if we're looking at supporting someone holistically with endometriosis. But there's lots of different herbs that can be adopted in these in this discipline. So one of the key herbs, I think I've seen in the chat, what's the best herb for pain herb, which is one of like the #1 question. I'm not sure if I can say there is the #1 because everyone, you know, unfortunately, for one it's this and the other person is this. However, this herb, as I'll flip to again, cramp bark, it's in the name, it says it on the tin essentially, Viburnum opulus, is one of the key herbs that is used extensively in amongst herbalists to help with period pain, with period cramps. So the fancy name or prop action is an antispasmodic. So essentially it helps reduce spasm in the muscle. It can also be used for like post-injury or sports injury for the same reason. It helps the muscle to stop being so sort of tight and agitated, and helps with the smooth muscle relaxation. But it does have an affinity to the uterus for some. We don't know why, but it does. It really does have an affinity. It seems to be pinpoint period cramps, especially in the womb and the uterus. I would use it a lot with relaxing the nervous system, so helping to help with that agitation and anxiety and stress that goes along with the pain always. And I would advise patients to use it when they start feeling cramps coming on. So usually that's like PMS, around your luteal phase, when the prostaglandins are revving up and all the inflammatory markers are revving up. So to help with those symptoms, we can use cramp bark, and you can take it as a tea or in a tincture form. I have got all the dosages and amounts, but I'm gonna I'll answer them in the chat, I think, afterwards. We use the bark of this plant, so this is it in autumn, but right now it's a perfect time to harvest it because it's the bark. It's a very like very sort of humble looking plant. It's a shrub, but yeah, it's the actual bark that is taken. Is again, it's in the title. So it grows natively here, and it's one of my top. Just to say, in terms of pain relief herbs, there's many that we can go on, and there's some very kind of more top shelf pokey herbs, if you like, that I would use in very acute pain scenarios. But they're not ones that you can just buy over the counter. They need to be prescribed by a medical herbalist. So it is worth having a chat with someone if you want a bit more information about that. This is another one of the one of my top faves. Yarrow. So yarrow has been used for hundreds of years as a traditional remedy. It's got a whole host of properties, but the key thing around endometriosis, it's a liver support herb, can really help with liver function, and it helps reduce bleeding. So it's known as a styptic. It's called Achillea after Achilles' heel, because it was sort of more of a fable or folklore. It may be true that Achilles, the Roman warrior, put a yarrow on the wound in battle, and it stopped the bleeding on his Achilles' heel. So it can stop bleeding. It's very good if in like a first aid scenario, for wounds and cuts and grazes. But internally for menstrual bleeding, it can be really helpful for reducing menstrual bleeding and flooding that can occur in more perimenopause. And it moves things around. So it's a circulatory herb. It's used a lot for regulating heart pressure as well. So it can move things, stop the minimize stagnation. I've talked about stagnation and that pelvic pain. So in that PMS scenario, yarrow is really, really good. It can help kickstart a period. It can be in a menagogue as well. So it can help bring on a menses or your period if it's being a bit tricky and it's not coming. So it's a beautiful herb, and it grows here as well. That's it, and it's full flower, and we use the flower and the leaves in herbal medicine. So Vitex is one that you may have heard of. chasteberry is the common name. I'm putting the common and the Latin name here. That's how we work as herbalists in the Latin, but it's just to clarify the herb easily when we use the Latin when we talk to each other. We know what we're talking about. So the Vitex or chasteberry is used extensively in hormonal conditions. It helps regulate hormones through neuroendocrine pathways, which is a fancy way of just saying that it can help moderate hormones like follicle stimulating hormone, luteinizing hormone, prolactin. So all of these hormones that are secreted throughout the month during your menstrual cycle. If there's imbalances, and we can see that through blood tests, Vitex or chasteberry can help with moderating, balancing those hormones. So it's used a lot with endometriosis, it's used a lot in fibroids, PMS, acne, infertility, etc. So I use it extensively. It's very well researched and well used by medical herbalists.
Just a point on that, just because I'm looking at your slides and seeing quite a few of the common hormonal issues and diseases that often crop up. If someone is to have endometriosis, does it tend to mean they're more likely to suffer from PCOS, fibroids, anything else related to hormones, or is it quite separate and actually they aren't necessarily that linked?
They're not necessarily that linked. So PCOS and endometriosis can present with similar symptoms. So both can have like heavy menstrual bleeding or painful periods, but or fatigue, but they are different conditions. With it is probably quite common for someone with fibroids to also have endometriosis with those lesions that can build up and adhesions, so the actual like cell growth that can form as adhesions that then we can minimize, or they can be removed surgically, and then the herbs can be very good at helping with that inflammation and that recovery from the tissue. They do have, like, someone with endometriosis may have X, Y, and Z as well, but it's not like just because you've got endo it means that you're more susceptible to having PCOS. Okay. If that helps. And lastly, one of the other herbs I'm going to just talk about is one of my favorites. This is what I did my undergrad research on, all to do with pain management and endometriosis, is California poppy. So it grows here as well. It's the whole aerial part of the plant that's used. So the flower head and the leaves. So the research shows that California poppy helps it moderates GABA pathways via neurotransmitters, which means it helps reduce anxiety and is pain relieving. It's an analgesic. So it can be really, really good for reducing anxiety and helping specifically with sleep. If sleep is being affected because of pain and anxiety, California poppy can be really helpful. It works really well with hawthorn and other herbs in like synergy. So a lot of these herbs do work very well with another plant. It's like the friends together, they work well together. The California poppy is one of those that I would use a lot in my pain and stress support blends. It's also an adrenal tonic, which is what we all really need to help with our adrenal glands, which are working overtime. So just a quick summary. I've talked a little bit about the liver. So these are some, I would say these herbs that I've listed: dandelion, burdock, turmeric, milk thistle, schizandra, reishi, someone may or may not be more familiar with. These are some of the liver tonics that I would use pretty much in every prescription I prescribe for a patient that's got pretty much anything going on, is looking at the liver clearance. And from a herbal medicine, and if you think from a Chinese, traditional Chinese medicine perspective, which we overlap in with my approaches from Western herbalism, we're looking at cooling liver heat. So when there's hormonal imbalance, like endometriosis, from a more alternative, I'm going to say that word, we're looking at there's heat and stagnation in the liver, and these herbs can really help cool and clear. So liver tonic herbs are fundamental to any protocol. They are an essential part of a herbal medicine treatment plan. I would say reishi is probably one of my herbs that I use in every single prescription if I can. It's and in terms of an immunomodulator, supporting the immune system on a really deep level, it's one of the best, and it's got very, very little side effects with medication, and it has an extensive amount of properties, and it originates from China. Okay, so moving away a little bit from the herbs, so we've got time to answer a few questions, aware of time. Menstrual cycle awareness. This is a practice that I've really adhered to and have learned. I did some training with Red School, which I'd encourage you to check out. I'm now a menstruality mentor, and I work a lot in this with myself, but also with my patients. A lot of this is like firstly dropping the stigma, dropping the shame and the guilt that's really, really, really ingrained, and we're still working on in terms of periods and periods that happen to half the population in the world. And it's about knowing, pinpointing and fine tuning that awareness of where you're at in your cycle. So it's going beyond just looking up your menstrual cycle app and going, oh, I'm on day 14 or I'm on day 6, which is great. And it's like looking a bit further into that, and with tools and practices to really look at what's going on, how you're feeling, how you're interacting with the world, taking responsibility for that, crafting the art of saying no. So creating boundaries, creating space so you can sit with yourself. I think if I come from my perspective, I still need to take 1 to 2 days off a month to manage to try and rest. It doesn't always happen very easily. Sometimes my period will come earlier or later than what I think it's going to. There's always slight unpredictability, but where possible, I look ahead always, look at my calendar, look at what I'm doing, and I try not to work or run workshops, etc., around those days. So essentially, with more education about your own menstrual cycle, you're more autonomous and there's more empowerment. And it really changes how you interact in the world, and you're coming from a more powerful place. So love to talk more about that, but I'm aware of time is a ticking. But yeah, do shout if you've got more questions on that. I'm going to be sharing a recipe as part of the follow-up email that the team are going to send out. So there'll be a recipe with some of the herbs that we've mentioned, and I'm gonna bring it over to you guys if you've got any questions.
Brilliant. Yeah, absolutely. So I've got the questions collated here from our moderator. The first one here for you, Claire, is any suggestion for herbs to support persistent bloating and joint pain? Now, it mentions herbs, but we'll kind of broaden that to herbs and perhaps supplements as well.
Bloating and joint pain, yeah?
Yes. Yeah.
Bloating, you're going to be looking at your calmatives, so your digestive support herbs. First point of call, we would probably be looking at whole chamomile flowers, fennel seed, mugwort can be quite helpful with bloating and indigestion. But yeah, I would say the mellow blend that Nappies do is amazing, and it is really, really good, and it's a really great blend, and it's got chamomile in it, and it's got marshmallow, roots. I'm gonna say that, to summarize, chamomile, fennel, marshmallow would be good herbs. Joint pain is a little bit more complex. I would have to sort of look a bit more on why that's happening, when that's happening in the day. It could be that, is it rheumatoid arthritis? Is it more after exercise, etc.? But again, we're looking at inflammation, generally speaking, and I would look at probably with a bit more investigation and research into your case history, but I would definitely look at omega-3 support for joint pain, whether that's through vegan supplement or through fish oils, depending on your dietary requirements. But yeah, I would probably go down that route. But again, I would look in more at the medicinal mushroom category for joint pain and inflammation as well, for more systemic inflammation and helping to reduce that.
Brilliant. And then just on my end, from in terms of what we would recommend in the Napier shop and online, if you were to come to us for bloating in particular, I think often if it's a gut or digestive health issue, we'd always recommend a really good probiotic. There are lots of good brands out there, and we'll also list some of those maybe in the email. But definitely for bloating, a probiotic could really help as well. Next question is, any suggestions for anemia or low iron?
Oh, I've just made an iron tonic. You want your vitamin C herbs that are rich in vitamin C that will help increase iron levels. So herbs that are really rich in iron, the sort of standard, really accessible one that I really would love to share is nettle leaf, which is growing abundantly everywhere across the UK. It's really, really rich in iron. You do need a lot of iron. You do need a lot of nettles to get your a daily amount that you need. So yeah, taking a concentrated herbal iron tonic can be a really good way of getting the iron in. And the benefits of taking a herbal iron supplement rather than an iron supplement that's prescribed by the doctor is that it can be more bioavailable, so your body's able to digest it and eliminate waste, and it's not going to affect your bowels as much. So I would say nettle's probably the top one to go by, but like yellow dot, gentian, dandelion, these are all really good vitamin C rich herbs that can help with that iron absorption.
Brilliant, fantastic. Someone has asked, are there various types of Agnus castus? Yeah.
I don't believe so, and I hope I'm right in saying that. I believe there's one Vitex Agnus castus plant that I know that, or true Vitex, if you like, is what we use in the dispensary. So as far as I know, there's one, but I might need to go and do my research. If there is more,
I think I'm in the same boat as you. I'm fairly confident there's only one, but yeah, maybe totally wrong with that one as well. And then a second question relating to a specific herb is, I'm looking to incorporate shatavari too. Any thoughts on this one? So shatavari is asparagus, I believe.
Yeah, Asparagus racemosus is the Latin name. Yeah, I use shatavari a lot. It's an Indian Ayurvedic-based herb. It's used as like a warming tonic. It's used a lot in fertility support. It's used for helping to modulate hormones again. It's used to help with painful periods and reducing PMS. So yes, I would say it is one of the herbs that I would use a lot in endometriosis treatment plans. So depending on, just to really, really quickly say, because I don't think I did, when we work with a patient, we take a really holistic assessment, and we can then look at your constitutional type. So we look at your personality type, what your body's saying, and then we can choose and create the herbs and the herbal formulas that are right for you. So yes, I would say in 9 times out of 10, shatavari is going to be a really good herb to support in endometriosis. And it may be that your body's more aligned and suited to white peony or another hormone regulating herb. And that's not, hopefully not to cause too much confusion. It's just to say that there's a bit of a matchmaking scenario of choosing the right herb, the right constitution or personality type. We can help you take that decision out of the equation, essentially, because we can help with that.
Brilliant. There is a question here I don't quite get, so if the person can type it back into the chat, we'll look at getting it answered. It's, what is your response and opinion on the advice to get pregnant from some GPs? I don't know, but yeah, if you could just retype that, rephrase it, we'll see if we can get that answered. The next question, Claire, would be, have you researched endometriosis and the transition into perimenopause/menopause? So yeah, what is the kind of link there, and how would you sort of look at that holistically?
So from what I've seen in my practice and through people that I've worked with in workshop settings, that cycle symptoms can change, and they often do when there's transitionals into perimenopause and menopause. I don't know if there's one specific thing I'd say, oh yeah, that definitely happens in peri or menopause, but you might notice more infrequent periods, more intermittent spotting in between cycles. You see a lot more people experience like more flooding, but I don't know if I can honestly say I've seen a correlation with specific endometriosis and into these normal shifts. It's not to say that they're normal shifts into perimenopause and menopause, the natural systems that happen. Sorry, no, I can't say I've noticed anything really, really specific to highlight there, apart from the normal symptoms.
I think that's fair enough. This one's a little bit specific, so maybe one that we'll, if you email us, we can look into and get back to you. But are there any herbs that you'd recommend to unblock fallopian tubes?
I would say it would be very much looking at again the inflammation that's going on in that tissue, looking at astringing the tissue to help in that tissue to perform its function. So there may be certain herbs that I would look at that would that help reduce adhesions. So thuja is one of the herbs used a lot to help with decreasing adhesion size, so in fibroids. So I don't know, I would need a lot more information on what that blockage looks like, but if there's adhesions or cysts, for example, we can look at specific herbs that can be used to minimize and decrease size. And I have seen this, and they do work, but yeah, I think it would be generally reduce inflammation and tone and astringe the tissue, and help repair it as well.
Brilliant, fantastic. And another question we've got is, have you looked into genetics and endometriosis? So I guess the question there is, are you more likely to potentially pass it on, or are you potentially more likely to have inherited it from someone who has endometriosis?
There's a wide range of research out there and papers. From what I've read, there has got links to being a genetic condition, but it's not inherently a genetic condition that you can catch, if you like, or be passed down. There may be more correlation if you've got that lineage in your family, your mother, your grandma, you may be more susceptible to it. But no, it's not a genetic condition. That's what the research, I think, is pointing to at the moment anyway. So, brilliant. Yeah.
Great. So I've got another question here. I'm wondering, when we have a client who takes testosterone, how do we navigate hormone balancing herbs? So I guess that's potentially another herbalist or another health practitioner. They're asking how to balance that sort of way up between if someone's on testosterone and the herbs that you potentially prescribe them.
Yeah, that is a really interesting area. I think you would be mindful of specific herbs to prescribe if they're taking testosterone, and looking at that hormonal balance. I would say I think it really is about working one-to-one and case by case when it comes to it, if I'm honest. But yeah, again, a lot of I wouldn't be putting too many hormone modulating herbs in, but I would be supporting other symptoms. I think if they're taking synthetic testosterone treatment, then that would be the key hormonal impact. And we'd be looking holistically around that, supporting other symptoms, whether that's sleep, anxiety, gut health, etc.
Brilliant. Yeah, I think
that.
that's a fair response. I think there's just so many different sort of drug interactions and hormone interactions that could potentially happen there. So we'd have to be on a case by case basis and looking at the individual treatment, I suppose, with that one.
Yeah.
We've got a question here around a moringa. Someone saying that they started supplementing with moringa. Any thoughts on this herb? It's actually not one that we stock at Napier's, I don't think, but obviously we do have quite an extensive dispensary, so I'm not 100% sure. But if you do know anything about that, Claire, then that'll be useful for this person.
Yeah, I've worked with moringa, like personally, I haven't prescribed it, but I know that I think it's very, very rich, like in multi-nutrients and vitamin C. So from that perspective, as a supplementation, or as a herb that you're taking, that's a very nutrient-rich and dense herb, and very full of antioxidants. So again, from that immune support perspective, then I would say that that would be aligned. But I haven't used it specifically with patients with endometriosis. But in terms of supporting your immune and your nutrient levels, then it'd be a good one to be looking at.
Brilliant. Okay, fantastic. And Claire, I've just realised the time. We have run over slightly from 8 o'clock. I'm personally okay to carry on. I don't know if you are. We have got a few more questions, but it's totally up to you.
We can carry on a bit. I know it's hard to funnel everybody's questions, but yeah, of course, we can carry on for a few more minutes.
Brilliant. I really appreciate you doing that, and I'm sure that the viewers do too. So we're going to carry on, guys, and just try and tackle as many as we can. If we say we go for another 10 minutes, and then any questions which we can't get to, if you email us, or we'll review those and we'll add them to the mailer or to the post-webinar response that we give you guys as well. Someone has said, finding this incredibly helpful. So fantastic. Thank you very much for the feedback. Honestly, thank you so much. Can turmeric root be used in a tincture? I'll leave that to you to answer, Claire, as well.
Yeah, it definitely can. And turmeric's used extensively as an anti-inflammatory, as the key antioxidant herb. It's used a lot for gut health support. It was shown to be as effective as omeprazole, which is one of the key protein pump inhibitors that's prescribed extensively. So it has very, very, very good profile. But yeah, as an anti-inflammatory and pain relief herb, it can be used. So it can be used as a tincture or as a root drunk as a tea. So yeah, it's a fantastic herb.
Yeah, absolutely. And I would second that. It's something that we get asked a lot for in our dispensary, but also that customers like to take, even on a daily basis, for a whole manner of different inflammation based issues and conditions. So would definitely recommend that. Question here for menstrual cycle awareness and birth control. So I guess it's just about how the menstrual cycle pairs with birth control and potentially any sort of interactions there with endometriosis.
Well, that'd be a lot to do with basically looking at your vaginal mucus throughout the month and how that changes, and that sort of stuff just isn't really taught in schools, and doctors won't really talk about it. But if you're looking at natural planning and fertility, then that's one of the areas that you can look at. If you literally type that in, it can give you an image of how that changes throughout the month, and then that can indicate where your most fertile window is and when your least fertile window is. So that's one way of looking at menstrual cycle awareness in that way. But yeah, there's no direct correlation with endometriosis, I would say, with that, but that is just another tool to be able to have more education about what your body's up to throughout the month.
Brilliant, fantastic. So there's another question here. Apologies for the stigma that may come with this question. As someone who is prescribed medical cannabis for pain, I wonder what the herbalist's place in this is. This is very much a plant and its herbalism kind of question mark. Thank you so much for any comments and the time to read this. So I'll kind of tackle this a little bit, Claire, if that's okay. And I would say, yes, obviously it is definitely a herb, and it has got a place in pain management. If you have been prescribed it for pain, then it will work well for a lot of people. We don't sell any CBD products at Napier's, not for any reason other than just a choice that we prefer to stick to more readily available plants and herbs and supplements as well. I don't know if you have anything to add to that, Claire.
I think there's a huge place for medical cannabis. I think that there needs to be more research, and then it can be more funding and more widely researched and reassure the general public. But in terms of like making sure it's safe and that the dosage is correct, I think there's a place for it. And I think for certain people, it's extremely beneficial. So I'm a real advocate of it, but I don't think I can dispense it legally, either as a medical herbalist. I think I'd have to have specific qualification. So I do know of GPs down here at a practice in Bristol that that are involved in research trials and that can prescribe it. So yeah, I would say I'm an advocate for it, and it can be very beneficial for pain relief and as an anti-inflammatory. But you need to know what you're doing and work with a professional.
Yeah, absolutely. Second those thoughts as well. So this sounds a bit specific, but actually opens up some quite good questions, I think. So I experienced the worst pain when I finished bleeding through to mid-cycle, and then the week leading up to my period. As I understand, this is when my estrogen levels are higher. Could this be that? Could this be what is affecting my inflammatory markers? Can a blood test show these markers? And then mefenamic acid can sometimes help, but what would there be? Would there be a herb I could use that works in a similar way?
Okay. So the first bit of the question was that more symptoms are happening around ovulation and just after, I think. Did I get that?
Yes, that's what I'm reading as well. Yeah.
So yes, your estrogen is peaking around ovulation, around mid-cycle, which is like day sort of 14 to 16, which is usually when you're ovulating. But then it's going to start declining, as well as progesterone after that when you're going into your luteal. So that's usually, as I said, that's usually when symptoms usually manifest and start presenting. Methylphenic acid. Sorry, just to answer that. Yes, a blood test would be able to show your levels, and you'd be able to pinpoint a bit more when your symptoms are showing and what that's going. But yeah, you could get a hormonal blood test, and then you can take markers throughout the month over a few months, and then I think someone's mentioned Dutch tests or other tests that can be really specific. You do have to go private for those, unfortunately, but yes, they can be very helpful. Methylphenic acid, I would say ginger root is something that's been clinically researched that has the same effectiveness as methylphenic acid as an anti-inflammatory. So it interacts in the same sorry, my brain's starting fading. The pathways, the same inflammatory pathways. It can be used so as an alternative to methylphenic acid. The COX pathways. Thank you, my brain. So ginger root can be used, and so it needs to be simmered for like 15 to 20 minutes at least. Sliced root ginger whole, and you can drink that. I would say be drinking that every single month when you start having your period. Cramps start to come on, and that can be used a bit like ibuprofen for some people. It can be very effective, but it needs to be a very strong brew.
Brilliant, fantastic, really informative there. Question around what is your thought of yam cream and magnesium? So I guess that is more specific to do with wild yam and also magnesium as a supplement.
Yeah, so wild yam cream is getting a lot of press, and it can be very helpful and beneficial with easing menopausal symptoms for a lot of people with uterus or people female identifying. It has a plant chemical that mimics progesterone. It's not progesterone itself. So yes, it can be really helpful with hormonal imbalances to help ease things. But as a antispasmodic, so it really can be really helpful to help with that period pain and that cramping that's going on. So I would use wild yam cream a lot, or in a pain mix. Personally, I use it more like that, rather than for the menopause. But a lot of women identify and get a lot of relief from the cream applied topically. You mentioned something else apart
And
from the wild
magnesium.
yam.
Magnesium, I guess,
Magnesium,
would be very good for
yeah,
kind of relaxation,
yeah,
recovery, that element of it.
yeah. Magnesium is definitely one of the key supplements I would say recommend to help them with that muscle tension. High good quality um, different magnesiums that can be very beneficial. So yeah, magnesium would be one of them. Zinc, probiotics, probably the key ones I would say in terms of supplementation.
Brilliant, fantastic. And I guess just one more question, Claire, because we are running on, well, 15 minutes over. We've both kind of got very much into this, which is fantastic. But yeah, unfortunately, out of time just now. It was just a return onto that question. The person has asked, apologies, it was to ask, what is your opinion on the advice from or by many GPs to get pregnant as a treatment?
I think that's a very personal choice, and you can take that a bit of advice how you wish. I don't know. I would say that I haven't heard that as a treatment protocol, if I'm honest. Um, I think that's quite problematic as a bit of advice.
Yeah, absolutely.
I don't think that's
I'm
right for everyone, and I think that's not really going to be. I might be solving one problem, but it might not be necessarily right for that person where they're
yeah,
at in their life. So I would say
absolutely.
I would say that's you can take that bit of advice and throw it out the window if you want.
Yeah,
It's your
yeah,
choice.
I'm pretty shocked to hear that that may be advice that a GP would be giving. If it is, then
Yeah,
yeah, just it's much more of a negative in my opinion than yeah anything else, because it's quite I mean, such a big life changing
yeah,
treatment plan, if you want to call it that. I mean, it's just a bit crazy, but yeah, obviously it's up to the individual to see if that's right for them. Then that may be something that they want to.
yeah. And I'm not to poo-poo the doctors. There's some incredible doctors out there, and but as an individual, you have a choice to change GPs to get a second opinion. Yeah, so
Yeah, and I
yeah,
think that's a good point to maybe just wrap it up on, Claire, is that what Claire's spoken about is such a broad base of treatment and many different options. So even though we've spoken about primarily Western herbal medicine today, and a one-to-one consultation can really help to come up with a solution personalized to you, that wouldn't involve a life-changing experience like getting pregnant. There are many different avenues, and it sounds from your experience as well, Claire, that there is hope. And whilst you're still living with it, very much kind of dealing with the symptoms on a month-to-month basis, actually, you found something that works for you to eliminate a large portion of the symptoms.
yeah,
So if you want to just
yeah,
sort of wrap up on that point.
yeah, absolutely. And I think it's work in progress and things change. But I think personally, yeah, I've found a huge amount of support. But that it does include taking specific supplements, changing diet, as I say, rest and carving out time and actually honoring that cycle and that time, and not rather than just pushing through the pain and taking painkillers and striving on. But yeah, the herbs have been fundamental, and wouldn't look back.
Amazing. Claire, honestly, thank you so much. It's been fantastic to hear your thoughts, your insights, and get your wisdom on endometriosis. Unfortunately, we have overran and run out of time tonight, guys. We will be sending through an email afterwards with the recording, maybe answering some more of the questions that you guys had that we couldn't answer tonight, as well as listing a few of the supplements and herbs that Claire's recommended. We really appreciate you spending your time listening to us as well. it's been fantastic to see the community. I'm just sort of peering down. I've been seeing the chat and how many of you guys have been engaging, and that's been brilliant. What we want to build here at Napiers is a community of people who, you know, are connected by a health condition that can be very debilitating, but know that there is light at the end of the tunnel, and you know, working, whether it's with us or working with another herbalist, can hopefully get you the help that you need, and maybe to improve your quality of life when your endometriosis is at its worst. So if you have any questions, feel free to pop us back an email when we send out that email, and we'll do our best to answer them. Claire also will share the slides, and there'll be information on how to potentially book with her if you're interested in that. We do offer free 15-minute consultations, and all of the herbalists at Napiers do have an interest in general medicine if you're looking for something else, but also very, very much can help you with endometriosis as well. So thank you very much, guys. Thanks for your time, and especially a really huge thank you to Claire as well for putting this together and really educating us all. So thank you very much.
Yeah. Thanks, Arjun.